If you're treating finger fractures or dislocations, making splints or recommending splints is a part of that treatment process. So let's dive into splints, what types of splints, when you need it, how long do you need it for, and all that good stuff. My name is Huang. I'm an occupational therapist and certified hand therapist. And over 10 years ago, I started my therapy clinic. And over 5 years ago, I started Hand Therapy Secrets to share my clinical skills, my clinical knowledge, and hopefully it will help you as well. One of the things that we always hear when you're starting out was like, oh, I don't know what to do. I don't know how to get started, especially in hand therapy. Been there, done that. And it took me a few years before I started working specifically in hand therapy. So if that's for you, if hand therapy is for you and you're just like feeling like, oh, it can never be me, it can be you. You just have to keep going. And part of going is learning about treatments and learning about splints. Whether you like making it or you don't like making it, it really doesn't matter what you like. It's really about what your patients need, right? So let's dive into very specifics making splints. Now, before we go into splints, let me just share really quickly. I have a splinting course, an orthosis course that's coming up September 27th and 28th in Miami, Florida, in my clinic. And we're going to dive into elbows, wrists, hand, and finger splints. So if you're interested, I'm going to include my link there for you. All right. So let's dive into finger fractures. What is the most common problem when it comes to finger fractures? You guessed it, PIP contractures. Now, it doesn't matter if it's the MP, the PIP, or the DIP. Majority of the time, PIP is going to be the problem. So I don't know about you, but I have a few cases currently right now, and that PIP is stuck, right? And you're going to get patients that come in at all various times, phases, and you just don't have a choice, right? So sometimes people are going to come into you fresh and they're straight out of the doctor's post-surgical case, and sometimes they're going to come to you after having tried all sorts of stuff. My clinic, I tend to be a second opinion for most people, so I'm not associated with any particular one doctor or surgical center, so they're just not feeding my practice. People watch my videos and then they find me and then they're like, oh my God, why is my finger not getting straight? So I'm sharing with you exactly what I do. So at the very beginning, if you have someone coming into post-surgical, right? If they're not stable or they have some stability, but we need to position them, you can be making a custom fitted splint out of smaller material. They're called finger canoes. So I would just use this. This is OrFit cast, and then this is just OrFit like regular. It doesn't have to be OrFit. It's just these are the small pieces I just grabbed from my clinic. So, but I personally do love using OrFit, but there's tons of different materials out there that you can practice. But a finger canoe basically just, like you said, canoes that finger, right? And you can make a circumferential where it goes all around, or you can just make it so that it kind of comes up and it's like a taco for your finger, right? So depending on where the injury is, you may want to keep this PIP straight. And splints are used for positioning, but they're also used for protection. So depending if you're like under 4 weeks, you might be using a splint for protection and or for positioning. So you're going to want that PIP like as straight as possible, right? Now, there's a time and place for this, and usually once you're out of that 4 weeks, kind of like time frame, you might not need something that is just static, and you might need something that is more dynamic. And it's a dynamic splint is tend to be used for someone who has a finger contracture. Now, even if they come to you early, even if they come to you on time, their finger might fall down into a flex position. One, because of the nature of their injury, they needed to be fixated in a flex position, or two, that's just the nature of our hands. If you take a look at your hands, the nature of your hands, your PIPs tend to be in a flex position. The majority of my patients come to me after they've tried other things, they've tried doing stuff on their own, they've tried other therapy clinics, and they're like, I still can't get my finger straight. What do I need? Number one, I like plaster casting, right? There's a time and place for plaster casting, and then you have to really talk to your patients about the benefits of it. Why would you use that over something else? And you have to get their buy-in, because with plaster casting, they can't get their hand wet. They can't use their hand. But it's one of the fastest ways to unstick a PIP when it's in a PIP contracture, right? So I'm actually in my splinting course that's in September. I'm going to be practicing plaster cast as well because I think it's a part of that splinting process. We are not just putting things on people or providing treatments because the doctor told us put a splint on it. We as clinicians, you have to have the critical thinking that says when do they need it, why do they need it, and for how long do they need it for. And that's really important when we're talking about dynamic splints. This is a dynamic splint, right? It's considered dynamic, and it's dynamic because you make the adjustments and you teach your patients how to make the adjustments and when to use it, how to use it. And this is a thing that's going to help get their PIP straight. I have some doctors here, and maybe this happens in your town, but they're just issuing this shit out like candy. Also, patients can go online and order this on Amazon because they heard that they needed it and they're just ordering it. The problem is if they don't know when to use it, how to use it, it is not going to be as beneficial to them. So as the therapist, as the hand expert, you want to know when you can start to issue this. You want to use this once there is a certain amount of clinical healing. So clinical healing happens between 4 to 6 weeks. And after 6 weeks, you're a lot stronger and more stable. So you can start to consider using something dynamic that's going to put a lot more pressure over a low load over a long period of time. So I wouldn't put this on someone that's, maybe their fracture is not stable. Maybe they need more clinical healing time. And so you have to use judgment. And then you can make the recommendation if you're doing certain exercises with them, stretches with them, showing them home programs, and they're just not progressing as well, right? Or they progress, but then they can't keep it. So those are two problems. You can get it, but you can't keep it. That's a different type of issue, right? And as hand therapists, I don't know for you, but usually my hand cases don't come in just a simple fracture. Usually it's a fracture, there's a dislocation, there's multiple fingers, there's a tendon. There's different issues that come up with those hand types of injuries. So as the expert, you want to talk to your patients about why you would pick this over casting, why you would pick casting over this, why you need to use this first before you move into this. So all of that is really important because people can just buy random shit on the internet, be given stuff, and they not know how to use it. And therefore, if they don't know how to use it, they won't get great results, right? This is very important. It has springs here. The way you make it easier for somebody is to squeeze it together, right? And then they won't feel as much tension. If you want them to have more tension, then you have to pull it apart. This is spring tension. And so that's how you change the graded amount of pressure over a period of time, right? Now, placement is going to be really important. You want to discuss where it is placed. Now, I use a very particular brand. It's the Royal brand. You can only get this from Patterson. I don't like the other brands. I have mistakenly, this is called a finger spring low tension flexion medium. I don't know, but I don't like it. I don't like it for flexion. I don't like it for extension. They're just not my favorites. So this is, yeah, it's to bring someone into flexion. I don't know. I don't know. I hate it. I bought it a long time ago. You can see I still have it because I'm cheap. I don't want to throw it away because one day I might need it. But I don't like this for the LMBs, and they come in different. They come in different sizes. I don't know. This brand is the Royal as well, but it came in super short. Look at this shortness. Look at this. What the hell? Look at how long this one is, right? So you have to pick the size based on your patient. Again, I've had this one. This is size A, but it's very specific for short, small fingers. So I'm going to save this too because I'm going to need it one day. Someone's going to come on a short little finger and they're going to need that splint. I'm going to have that shit, right? So the size is here. But the key thing with putting it on is you need to know where the tension is. So It is meant to push down here and then push up here so that you can get that PIP extension. The key thing with this splint is this piece right here. You do not, let me see if I can draw my line. See this line right here, this crease? That is your joint. You want to make sure that the placement, you want to make sure the placement of the splint pushes in the correct place, which is right here underneath that line. You want to feel that tension there. You want to feel the tension up here, your patients. You want to make sure they're feeling it there. And then down. So this is your distal palmar crease. You want them to feel it right up here. So from here to here, you have to catch the bases or the ends of the phalanx, right? So that you can apply the pressure in the right place. If that thing is applying pressure above that DIP line, then what you might end up getting is something like this. And you might be promoting a pseudo boutonniere, right? Just kind of like this boutonniere looking thing. It's a pseudo because a boutonniere is a true extensor tendon issue. Let me not divert through the topic. So the most important thing about this is when would you recommend it? Making sure that you're doing it correctly, placing it in the correct way, wearing it in the correct way. Your patients are going to forget how they're supposed to do it. You can tell them sometimes you need to repeat. Sometimes people get it. Sometimes people need a little bit more instruction because it feels foreign. And, they don't see this all the time. They don't have this type of injury all the time. So they might not always get it. I mean, I work with really smart people and sometimes they don't get it, right? They don't get how it's supposed to feel. So you want to be able to, make sure that they understand what the whole point is, right? So if you have a PIP contracture, we want to push up at that end of the bone and push down at the base of this one so you can get that finger straight. Like F that fracture, right? F that contracture. Okay, so make sure you're wearing that correctly. And also, so them wearing it correctly is based on you as a therapist giving them the correct instructions and directions and making sure you double check them. Just make sure just because you issue it doesn't mean you shouldn't double check them. I issue it, I double check my patients after a week, after 2 weeks, because things do change and that's why it's considered dynamic. You help them change it. Now, the last thing I want to mention is wear schedule. So a lot of times people will just wear that LMB all the time or wear that splint all the time. There's a time when you need to discharge something. When it comes to the LMB splint, I usually tell my patients to wear for 30 minutes and then work up to 2 hours. Then after they wear it for 2 hours, then they should wear it at night. It is a low load spring tension dynamic splint to help get that work on that contracture for you. So what happens is when people are wearing it all day long, they're working against that splint. So now you put the splint on to straighten you up, but then you're using your hand, you're working your hand. So you're working into that splint, which is not the purpose of that splint. Plus, if you wear it during the day, you're not using your hand. And then plus, if you're wearing the day and you use your hand, then now you develop some really abnormal patterns with it. So if you're going to wear it during the day, just wear it for a little bit and take it off. But usually I tell my patients, I want you to switch from wearing it from the day and start wearing it at night, because it's a nighttime that you're sleeping for 6 to 8 hours that you're going to really truly get that low load stretch over a period of time that's going to straighten out that joint. And then during the day while you're up and you're active, then do the active exercises and use your nighttime hours to help you do your therapy, but it's in a more passive way. So this is how I use splinting or AKA orthosis with my finger fractures. There's so many different hand injuries, hand fractures, different types of splints that you can make, you can use for so many different things. And as the expert, you're the therapist, patients are coming to you so that you can advise them. Am I doing okay? Am I doing, is this working? Why does this work? when am I going to get better? They're coming to you so you can answer all those questions for them, and then they're coming to you so you can also confirm to them that they're doing okay and what they need. Doctors are referring patients to you because they want to know that you're the one who's going to make these recommendations, right? Yes, do they write it? Of course